And let's take up our briefing on homelessness if Ms. Gray is on the line. I see that she is. And colleagues, we received this briefing in our inbox at 10:10 this morning. Welcome, Ms. Gray.
Thank you. So I apologize. I am joining by phone due to some technical difficulties with the loaner laptop. So I believe I'll be able to see the presentation as we present, but won't be able to see you. So please let me know if there are questions as we move along. I believe we have joining us either via phone or perhaps in person, Charles Lucen and Greg McCormick from our staff, in case there are questions, as they were very much boots on the ground for this initiative and can answer some additional questions, any additional questions you might have. So I will just generally say I am very pleased to be here briefing you on the completion of phase 1 of the HEAL initiative. It has been a very busy 7 months for the Homeless Strategy Division and a number of partners who have been really critical in this effort. We relocated the final of the 4 encampments a week ago yesterday on the 31st of August. And so what I will be providing you today, a really high level data, the initial data cut as we look at the demographics and some of the early indicators of results of the initiative, as well as some observations about things that have worked very well, things that we will be looking to improve in the future, and observations about program design as we move into what we're very happy will be phase 2, subsequent to council approval of funding for that phase during the budget process. So we can go ahead and go to the next slide. So as you know, the resolution creating the HEAL initiative was adopted on February 4th of 2021. And the initial timeline for the completion of phase 1 through resolution of the encampments was 6 months. We did ask for a little bit of grace to take 1 additional month because of Winter Storm Uri, the deep engagement of all of HSD staff in the sheltering and other efforts associated with the storm. And so that would have been September 4th. We completed it just under the wire at August 31st, and I do want to say due to Herculean efforts on the part of staff and many of our partners. The first phase of the HEAL initiative targeted encampments in Northwest, Southeast, and downtown Austin, all based on concerns of health or safety for those sites. The initial 4 sites were generally described by the resolution, and so we had a limited number of choices of sites to work from based on different kinds of hazards, whether those be traffic hazards, floodplain, in park areas that were otherwise utilized by broader citizenry, but also have been charged with developing prioritization for future encampments, which we'll talk about a little bit toward the end. And so let's then go ahead and move to the next slide. So I think the unique thing about the HEAL initiative is that it really combines a desire to move folks swiftly into shelter and housing with a focus on our public spaces as well. And so we are targeting resources toward encampments rather than by need or vulnerability, which is what our system generally does. It adds to those resources rather than replaces them. So we still house people throughout the community based on their needs assessment, but this also allows us to address those situations in which there is an encampment that is causing concern around health and safety for the people in the encampment as well as potentially the surrounding community. in order to make this work, we not only contracted with social service providers who are providing rapid rehousing programs for participants, but we did create dedicated shelter space. Initially, that took the form of the Southbridge shelter, which is the former roadway inn that we had been utilizing as a pro lodge for the duration, really, of the pandemic, but pivoted that to utilize as longer-term bridge shelter. We do believe that's the long-term use of that facility, but as we will discuss, did open a second bridge shelter, which we are utilizing at least partially for the HEAL initiative, though it may not be solely dedicated for that purpose. We work with HOST and our other outreach partners in the community, like the PATH team through Integral Care, to engage individuals on site, offer them shelter and long-term housing, and work with a variety of our public space partners, to relocate folks to shelter and then to carry out the cleanup of the sites. So Parks and Recreation has been a critical partner in terms of transportation, Austin Resource Recovery and Public Works, along with the cleanup contract with the Other Ones Foundation, have all been very important resources in terms of reclamation of the site once we are able to relocate people. And then finally, this initiative, of course, was passed prior to the passage of Proposition B on May 1st, and so it really asked us to look at ways to encourage voluntary compliance with those spaces being no camping spaces. That has played out a little differently, as you can imagine, in the context of now having an ordinance that bans camping in public spaces. But we still think that we have had some lessons and will continue to have learnings as we move forward with this initiative about how we can maintain spaces without a sole reliance on enforcement by police officers. Next slide. I spoke to the 7-month timeline for this overall initiative, and I wanted to give a recap of what the major elements of that have been. So the resolution was passed February 4th. About 5 days later, we began to experience Winter Storm Uri, and really our team came out of that entire experience toward the end of February. And during March and April, identified the partners with whom we could work, facilitating contracts by extending existing contracts rather than going through a new procurement process given the tight timeline. We had to identify how we might secure dedicated shelter space. At that time, Pro Lodge 1, or the roadway, was still functioning as a Pro Lodge, and so we needed to plan to demobilize that site and convert it to shelter. And then we, of course, needed to talk through process of what it would look like really on site from the day that outreach workers arrived there through relocation and engagement in services once folks were in shelter. So we had the collaboration kickoff at the end of April, and then the next week asked Council to approve service contracts for both Integral Care and Family Elder Care to provide rapid rehousing services, for Front Steps to operate the shelter, and to provide some additional resources to add a couple of outreach workers to the host team from Integral Care. We, at that point, moved toward contract execution and hoped to begin relocations at the 1st of June once we had the Southbridge shelter, which was the former roadway, up and running. Unfortunately, our contractor there experienced some delays and were not able to initiate their work on site immediately. In the face of that delay, Homeless Strategy Division staff quickly pivoted. We hired a cadre of temporary staffers, many of whom had been our partners at existing Pro Lodges, and ourselves opened the shelter on the 16th of June, allowing us to then resolve our first encampment, which was at the Terrasses Library, and that took place from June 16th through the 18th. We then moved to the Ben White and Manchac site. That was July 14th through the 16th, and did that just in anticipation of Front Steps then being able to come on site at Southbridge and assume operations. So HSD staff with temporary support did operate that shelter for about a month. The Ben White site was substantially larger than Terrasses. Terrasses was about 20, and Ben White Manchac was about 50 people. So with those two sites, we did reach capacity at the Southbridge shelter, which overall has capacity for about 75 guest rooms. Having then reached that capacity, we needed to either wait for folks to be rehoused, which we knew would take a little bit of time, or create additional bridge shelter space to move on to our next site. We eventually determined that we were in a position to demobilize Pro Lodge number 4, which is in the former country and that the city also owns. And so we did that in, when I say we, I mean my staff, did that in record time, demobilizing as a Pro Lodge on Monday, Tuesday, and Wednesday of 1 week, and moving in folks from the third HEAL site on Thursday and Friday of the same week. That third site was the downtown location at Cesar Chavez and Congress, and so, as I said, completed that on the 5th and 6th of August. Finally, we were able to complete the final site on, as I said, the 30th and 31st of last week. Oak Knoll was also a smaller site with 23 individuals moving into shelter there. And so that sort of wrapped up the activities over the course of the 7 months. And we are now moving into analyzing certainly some of the demographics and data that we have now that everyone has been relocated, looking at our plans for prioritization of future sites, as well as hiring for permanent staff to staff the initiative overall. Next slide. So this is really just a summary of the contracts that were put into place for the first phase of the HEAL initiative. As I said, 2 rapid rehousing contracts, a contract with Front Steps, or a pair of contracts with Front Steps to run the bridge shelter, and some support for integral care. We are also, of course, operating the North Bridge shelter. That is being done with ARP funds that Council has approved. That is not included here, as it was not specifically dedicated only to HEAL, but those are resources that are being deployed. And of course, Council has approved $6 million for the second phase of HEAL. We will be looking forward to potentially expanding the existing contract so that we can continue relocations in fairly short order, but also anticipate including rapid rehousing and some other services in a broader solicitation that would happen this fall. Next slide. So I do want to talk about demographics of the population that we have served thus far in the HEAL initiative, with the caveat that these are very preliminary numbers. We are still entering data into the Homeless Management Information System, but have been able to collect some basic demographic data on our program participants. And one of the things that Council asked us to do was to report on those demographic criteria, but I think it's important that we also be comparing that to the population of people experiencing homelessness in Austin overall, with a real eye to equity, to ensure that, because this is a new approach, that it is not substantially differing from the demographics of homelessness. And I mean that in particular around the African American population. So given that we are taking a resource and going directly to the streets and offering people housing, we want to make sure in particular that we are not underserving the African American population, who despite comprising less than 10% of Austin's overall population, comprise 35% of people experiencing homelessness in our community. So we'll go to the next slide. These are our initial numbers, and again, we need to refine and scrub them, but off the bat, 33% of the individuals offered shelter through the HEAL initiative were African American, compared to that roughly 35% in the homeless population overall. There are a couple items here I think that we will need to explore further. One is looking at how that compares to the overall population of unsheltered individuals in Austin, because I suspect that we may see a slightly higher proportion of the unsheltered population actually being African American in our community, in which case we would hope that our HEAL initiative would mirror that. And then also just doing a little bit of statistical analysis, given the small sample size, to understand whether there's any statistical significance to the difference that we might be seeing currently. Next slide. If we could advance to the next slide.
I think perhaps you advanced 2 slides.
Yeah, I think that I cannot see. For some reason, my video speed is slow, but the phone is working. So you can go back to the one slide and let me see if I can track it on my computer.
So now we have a slide up, Diana, about gender.
Yes. And so generally speaking, the gender of overall population of people experiencing homelessness in Austin is about 40% female. Now, I think that this is likely, again, the overall population, and so we want to understand what that gender breakdown looks like in the unsheltered population, which I expect to be substantially higher in terms of the male domination of that demographic. If we go to, actually go 2 slides further, what we are seeing is within the HEAL population thus far, approximately a third are female. If in fact that percentage is below what we're seeing in the overall unsheltered population, it's something for us to be concerned about. So we will be tracking that difference. Slide number 8 looks also at age, which is something we don't have the breakdown for you today. We will be drawing that from HMIS so that the categories are comparable. But again, want to ensure that, through the HEAL initiative, we are not underserving our elderly population experiencing unsheltered homelessness.
Could we pause here for just a minute? The slides weren't quite synced. So this is the age data. Would you mind repeating your summary comment on this one, please, Diana?
So what I commented on regarding age is that we don't have the detailed breakdown in this format yet for the HEAL initiative, but we will be providing the comparison. And I think that given the vulnerabilities introduced by being unsheltered, we want to make sure that within the HEAL initiative, we are serving at least as many folks in those older categories as we see in the general unsheltered population. So this will be an area for further reporting for you in the future. And again, this data is the overall homeless population provided by ECHO.
Okay, I think we can advance now.
And we'll advance one more. So this is, I think, where we begin to see data that is really critical in terms of understanding the impact that we are having 147 people were moved into shelter during the months of June, July, and August. 95% of those people who were offered relocation to Bridge Shelter accepted. And that certainly flies in the face of what can be a perception that people aren't willing to go into shelter. So very excited about that. We have remaining in shelter 119 individuals, and 95% of those have now completed coordinated assessment, which is something that needs to happen before we can get them enrolled in a housing program or concurrent with that. Interestingly, when we did, as an example, the Ben White site, only about half of those people had completed a coordinated assessment. But when we did the downtown site, about 90% had already had a coordinated assessment. That was partially due to the fact that Host is very active downtown. And so we'll talk a little bit about what that means in terms of process, but it'll be interesting, I think, to see as people come in, we have a better sense of what the penetration of our coordinated entry system has been in the unsheltered population and how many folks are still in need of a first-time coordinated assessment, acknowledging that many folks may need an update. We have got not quite 60% of individuals enrolled in a housing program at this time. And what that means is not that they are housed yet, but that family elder care or integral care has taken that referral and formally accepted it and taken them onto their caseload. We did have some lag at the beginning, both because when people entered, we did not have them have their coordinated assessment completed, and we, in the early weeks, were getting our contracts executed. In our Pro Lodges overall, our average time from enrollment in a housing program to placement is essentially between 60 and 70 days. And I think that's certainly someplace we would like to meet that, ideally exceed it, but right now we are just starting to see exits to housing. And so, you know, that really represents the first couple of weeks in shelter in June for the Terraces occupants of the Terraces encampment, who then became enrolled in housing programs in July, and then have been in July and August, and now are beginning to exit to housing. We also want to be really cognizant about attrition. And I will tell you that we've seen, you know, based on the numbers, the gross number is something like 17% of the total population exit shelter. And those are a combination of things. Some folks voluntarily decide that they for whatever reason, don't want to be in the space anymore. We have a few folks who have are hospitalized, have engagement with the criminal justice system, or some other incident that causes them to leave, but we have certainly also had exits, involuntary exits, based on behavior, et cetera. And so I think it's really important that we work with our with Front Steps, who is operating the South Bridge, and with our staff at North Bridge, just to make sure that we are operating those shelters as effectively as we can to ensure that people have the supports on site to be successful in that environment and to exit to permanent housing. So this is something, these numbers again are very preliminary. It's a little early to tell, but they are, it is something we'll be tracking and parsing the data more closely between, you know, what is an involuntary exit that might be someone being asked to leave versus a situation in which someone has a, you know, a neutral exit or an exit because of another reason that doesn't necessarily have to do with the management of the shelter asking someone to leave. So next slide. I am going to assume that then we've gone to the next slide. I can't see it currently, but just to talk a little bit about what the lessons learned are at this stage. I mentioned, first of all, I think the banner here is that we've had near universal acceptance of relocation. We have seen that we can engage folks quickly in encampments and do this work rapidly, over the course of a week or so. So we need not have a substantially longer engagement, which is something that we really did anticipate at the beginning. However, we also have experienced some challenges in terms of enumerating who is at the encampment. There are folks who move between encampments, and if they are not sleeping with a tent, it can be difficult to tell who is a permanent occupant of the encampment versus a visitor. And to varying degrees, we had in-migration at each of these sites. So the word gets out and people show up, understanding that they may be able to access shelter and housing at a site, which sometimes is quite simple. You're simply able to communicate that the program design is that we go in and we serve folks who are occupants of that encampment, but otherwise can also be quite threatening to the success of a particular site, because if too many people show up, not only does it create confusion and tension, it may mean that we can't move everyone because we don't have enough rooms at the shelter to do so. And so that's something that we're going to need to manage carefully going forward. In terms of relocation and cleanup, first of all, I want to again emphasize the incredible partnership across city departments, incredible responsiveness and willingness to help, and I think investment in the success of this initiative. But we do need to make sure that we have reliable transportation resources. Parks and Recreation has been an incredible partner, but part of the reason they've been able to do that is that many of their in-person programs are not operating at full capacity right now. And so particularly if we anticipate increasing the volume of encampment relocations, we may need to look at other alternatives for how we arrange for transportation for individuals and their belongings from encampments. One thing I think we learned with cleanup is that in order to minimize the likelihood of repopulation of a site, we need to complete the cleanup quickly. When tents were left, we weren't able to complete a cleanup in 1 or 2 days, and particularly by the end of a work week, we did see repopulation of tents that had been left behind. And so, at this point, that experience is somewhat impressionistic, but we do believe that completely cleaning a site signals that it is no longer a site where camping is anticipated, and we've not seen repopulation in some of the other sites where we were able to complete cleanup with a more defined end date. The space activation, I think that, one of the things that we contemplated as part of this initiative was how we might reactivate spaces for continued public use for all Austinites, appropriate to the design and initial intent of the space. We have been having discussions, for example, with Jurasis about what will happen at that site. The neighborhood is engaged, but it is a longer timeline. So we need to be thoughtful about what the short term looks like after an encampment is resolved, compared with what might be longer term reactivation of the space. We've also seen, in terms of cleanup, there's some substantial environmental concerns, from human waste to rodents, which I think really emphasizes for us the health concerns of people living on the street, but it's also a concern for our cleanup personnel. And so that's something that we'll be looking at. In terms of the success of bridge shelter, we were having staff feverishly entering data into HMIS as late as Friday and early this week. That dedicated staff we think is going to be critical to making sure we understand what's happening with the program overall. We have had some real constraints around the availability of assessors to complete coordinated assessment in the community at large, and we are seeing that play out with this initiative, and so need to ensure those resources are secured. And we certainly, we have now got on-site behavioral health services at both of the shelters, but we want to underscore how critical that is, particularly in the first weeks after relocation, where it is a good thing, people are excited, but that transition can also be difficult, and we can see people struggling with some of their behavioral health challenges, both because they're dealing with the new challenge of transitioning into a new space, and because, frankly, they are safe enough to come out of survival mode and begin grappling with some of those issues and are ready to do so. And then again, just to, I think, to emphasize that, we're really committed to seeing the process of relocation, shelter, and rehousing resulting in high rates of permanent housing. And so we'll be tracking those attrition rates across the experience of individuals coming into the initiative to ensure we're course correcting anytime that we can. So next steps really include us, as we are now working on the prioritization that would help us identify upcoming encampments in partnership with multiple city departments. We, of course, will need to turn toward contracting for services for phase 2 and are working on that, and I believe that will be a combination of an extension of existing contracts and new solicitation. And then, we have been operating this initiative with temporary staff within HSD and staff who are simultaneously dedicated to the HEAL initiative and community engagement overall, both of which are really more than full-time jobs. So, kudos to the staff that have been working with us, but we will be we expect to be posting full-time positions, those permanent positions that have been approved by council within the next weeks. With that, I will pause and take questions.
Great, thank you so very much. This is really super work. Councilmember Kitchen.
Yes, let me just say, Diana, you and Charles and Greg and your whole team have just done a phenomenal job. And it is very much appreciated and noticed. And so I want to say that I know it hasn't been easy, as you said. You mentioned the challenges, but you guys have stepped up to the plate at every stage, and what you've accomplished is fabulous. I am also very, I have a ton of questions, but I'm just going to ask a few specific ones right now so that my colleagues can ask questions too. I want to focus in on a couple of things. I think that what we've seen so far shows the effectiveness of this approach in terms of people accepting. I think it's important to note that that is one of the concerns that people had initially, that people wouldn't accept going to a location. This is a huge, I think you said it was 95% or something very, very high in terms of people accepting it. And so that is fabulous. I think that I'm very pleased to see the attention to analyzing every stage. And so analyzing the attrition rate is going to be critical, because that's going to tell us what we need to add or think about for that stage of going from temporary shelter to permanent housing. So I have a question around that. I know that you provided some preliminary information, which is very helpful. I think I heard you say that you're working on getting a breakdown of those folks that the involuntary exits Do you have an idea on when you might have that breakdown? And related to that is that, to what extent is that information captured? Is that data captured when somebody leaves? So if you could speak to that.
It is captured, council member. Thank you. And so I think that we can provide that for you. I would say within the next 3 or 4 days.
Okay.
And yes, I think we want to look at kind of how we categorize it, because there are exits that are neutral, or that are some are positive. For example, we would have had one individual exit and reunite with family. So we didn't end up serving them through rapid rehousing, but they are back in permanent housing, right? It's a positive exit. We've had individuals exit to go to hospital, which and individuals who have had interaction with the criminal justice system and are going to spend some time incarcerated. And so while those are not positive things, they are not exits that are related to behavior, within the shelter, or the individual electing to no longer participate. So we will parse that in a way that's meaningful for you, and we'll continue to provide that as we move forward.
Okay, 2 other quick data questions, and then I'll turn to others. So in terms of the data that's available, so if someone exits to the hospital, for example, do we have a mechanism for or a social worker who is following that individual that then knows what happens to them after they are discharged from the hospital?
Yes, we would typically, staff would, either at the shelter or through rapid housing would stay in touch with that person, and assuming it is a short, or a short to medium term stay, we would hold the room for them. We certainly want them to come back. And so I'm actually going to, I see that both Greg McCormick and Charles are on the line. And so without, of course, giving any personal details, they may have feedback as to what that has looked like in terms of our experience to date. Greg or Charles, do you want to give some context?
Sure, I can, and we do have that data, so we'll be able to provide it to council, as Diana said, very soon. A number of individuals did get arrested for warrants that were outstanding, but the individuals that go to the hospital, we continue to work with and hold a room for. We want to get them back and get them engaged in housing. And something maybe to keep in mind is these individuals were individuals that we sought out through these encampments to bring into Bridge Shelter. And so this was really kind of an abrupt change in their life. And I think that we can really focus more on some of the wraparound services and acclimating them to Bridge Shelter as a first step of getting ready to go into housing. This is really kind of a microcosm of where we can learn things about the health needs that individuals need to work with, get healthier, get ready to go into housing so that they're successful once they do and go into housing. I think it's a really good first step.
Okay, thank you. Then last question. The data from ECHO, does that data have breakdowns by sheltered versus unsheltered for the kinds of demographics that we're looking at?
So the data that we showed was overall data, but we should be able to get at least some of those data points by sheltered and unsheltered. And so we'll work with them to make sure that we are comparing apples to apples going forward. I think that's going to be critical because the overall population, understanding that demographic, of course, is key, but we are talking about the unsheltered population here. And so we'll work as we move forward, I think, to develop reports that look at who we are drawing into the initiative as compared to what we understand about the overall unsheltered population, acknowledging that not everyone who is unsheltered is in HMIS and will be, part of ECHO's database.
Okay, I will pass this on to others. Like I said, I have other questions, but I want to be able to share that. I know my colleagues were all very involved and supportive of Passing Heal and are interested also in understanding what we're learning so far. I do want to say again, thank you all very much. I can see that this has been done in a very systematic careful way, in a way in which we are learning from, which was the point of starting with 4 locations as a pilot and learning from it. I think we have much, much to learn from how this kind of approach can contribute to long-term and stable housing for individuals. And so I really appreciate y'all's efforts. Thank you.
Thank you, Councilmember.
Ms. Gray, I know you said you would supply us with that additional information, and I assume you meant the entire Public Health Committee.
Yes.
Super, thank you. Yes, Vice Chair Fuentes.
Thank you. And to echo Councilmember Kitchen, I want to thank staff and Councilmember Kitchen for your leadership in bringing forward the Hill Initiative. It's wonderful to hear about the near universal acceptance rate that we have into transitioning into our bridge shelters. And so that's wonderful news, and I am thrilled to be able to share that with our community. My first question is on the North Bridge shelter. Would you mind sharing what our capacity rate is at that shelter?
So I'm gonna speak a little bit and let Greg correct me if I give you the wrong total number. So the North Bridge shelter is a former hotel, of course, with 75 rooms. And so not all of those will, even at full capacity, will be available for guests because we use some of them for staff offices, for the service providers, et cetera. Right now, however, I believe we have 54 rooms or 55-ish occupied. Greg will pipe up and correct me here. We do have several rooms that are offline for repairs post demobilization as a pro lodge. And part of that is that we had plans and are moving forward with plans to replace the flooring in a number of rooms. And so facilities in the process of working with contractors to make that happen. And we can get you an updated timeline on that. But we did have some rooms that were not occupiable because they were in the process of having some work done.
Gotcha. So what would you say is our vacancy rate right now between both of the bridge shelters?
We really squeeze folks in to make the site 4 happen. So I don't, Greg, do you have feedback on that?
Yeah, sure. So when we were moving folks into North Bridge, Charles and I were on the ground literally counting people to make sure that we didn't send more people to North Bridge than the rooms were available. So by the time we were done with the 4th encampment, we were 99% full at both South Bridge and North Bridge with available rooms.
Gotcha.
You do bring up, I think, an important point, though, Council Member, that I probably should have brought forward, which is that one of the, I think, potential downsides, or it was trade-off of this approach, is that it does require us to hold rooms empty, right? So if we have 20 people at an encampment and we intend to, we really do believe that moving people all at once over the course of 1 to 2 days is critical. They move as a social group, and, the momentum really helps the process along. But that means that you have to have that many rooms open. And so, we're going to be looking at what that rhythm will look like as as people begin to be rehoused, et cetera. My hope is that the effectiveness of the approach and the ability to move people into permanent housing pretty quickly as they come, a service provider ready to enroll them will make that, still a net positive for us, but it is something that we will be seeing is having to hold some blocks of room to open.
Thank you. That's super helpful, because that was kind of what I was getting at, was trying to understand what, for the next phase of HEAL, how quickly can we scale the volume of individuals that we're able to move into shelter? So having a sense of what is our capacity and open room rate, I was trying to get a better sense of. Very clearly this HEAL initiative is effective and it's working, and it's certainly needed to meet the scale of the crisis that we're in right now. And I just would like to vocalize my support for us moving forward with phase 2 and to look at how can we increase the volume, especially given the investment that we've made during the budget process in our homelessness strategy office and having more staff support so that we're able to quickly mobilize. I know that you have been so wonderful in working with my office and working with our neighbors at Cullen Lane for the encampment that we have in District 2 that, as we know, has considerable safety concerns given the proximity to the neighborhood there. And so I really would like, again, to say I would hope that Cullen Lane would be an encampment that we have considered in the next phase of HEAL as part of phase 2. And so any information that you can share about what that process looks like or what more is needed for us to move forward on that second phase, I would super appreciate.
So my intent is to bring to this committee at our next meeting our proposed prioritization method. And also I think a bit about how we would feed knowledge about encampments into that, prioritization process. So most encampments have at least one city department who is engaged with them in a substantial way, whether that's because they're on park property or they might be in the watershed or because host has been engaged there and we've heard from our APD partners that there are concerns. And so we're really looking at how we can effectively across departments synthesize that information and then be clear about why, which sites we would be prioritizing for the HEAL initiative and why. And so we look forward to briefing you on that next meeting. Charles Lucen and Dr. Mary Lenigro on our staff, who is a Fused Fellow, are working with across city departments to both figure out how we do this in the short term for our very next encampments, and then even looking at in the longer term how we can utilize technology platforms to make that work more efficient and the information shared across our partners. And Charles, did you have anything to add there?
I have nothing to add. That's a great summary. Thank you, Diana.
Thank you, Charles.
Good deal. Thank you so much for that. I'm looking forward to that next update that we have and talking about the prioritization matrix for the HEAL initiative. Again, just want to thank Councilmember Kitchen for your leadership in bringing forward the HEAL initiative. It is effective. We now know that it has a universal acceptance rate for helping us meet the needs of our unhoused neighbors. And I really appreciate all the work that our city staff is doing to help in this effort. Thank you.
Mayor, it looked as if you had
Yeah,
some
if I could-
questions. And we probably will need to wrap up no later than 11:15, just so we have time for that second presentation.
And I'll try to keep my comments brief questions. I also want to really thank this group, Dianne Grey, Charles. It just is really good work with HEAL. I think that this is the kind of visible progress the community wanted to and needs to see. It being done in a way that is actually getting people off the streets and out of tents, but in housing or on a track to housing with the hope that they don't return back to the tents. So it is exactly the kind of work that we need to do, and we need to scale it. I also want to add my thanks, Councilmember Kitchen, for authoring the original HEAL resolution. And I basically had two questions. The first one was, how do we scale this? How do we make sure that you have the teams and the staffing and the spaces to be able to get more people out of tents, wherever those tents might be? Sounds like, Diana, you're going to address that at the next briefing when you talk about priorities and spend. But I assume that part of the ARPA dollars that we put toward this goes to this kind of work. The second question I have is, how does this HEAL work relate to the goal that the community has set to house 3,000 people in 3 years? Is this part of that system that you spoke about setting up earlier?
Absolutely, Mayor. And so, in fact, part of the summit goals not only spoke to rehousing an additional 3,000 people over the next 3 years, but did speak to an explicit encampment strategy, very similar to HEAL in terms of going out and rehousing people from encampments. And so, of the 3,000 individuals that are sort of our minimum goal over those 3 years, we talked about 2,000 of those being housed through rapid rehousing programs, and with what we think is at least 200 people for phase 2, and we've sheltered 143. So the house number we know will be slightly south of that, but easily 300 people, I think, in phases 1 and 2 of the HEAL initiative. I think it's important to underscore the overall summit plan has somewhere close to $40 million recommended to be dedicated to rapid rehousing. And so we, with the ESGCV dollars that have gone out through the city already, and these dollars, there's probably still another $20 million that we would anticipate mobilizing over the next 3 years. Some of that can be done, it doesn't all have to be through HEAL, but I could see us scaling. And I think that one of the questions that we as staff will continue to look at, not just in the next month, but ongoing, is what is the scale that we can, as a system, absorb in terms of this direct encampment rehousing effort. And that is contingent on a number of resources. So that is to some degree about what does our shelter resource look like? How quickly are we rehousing people? Can we get the units in the market? So all of those resource questions are things that we will come back to you with. The $6 million that council approved during the budget process is our initial investment that will get us moving into phase 2. It need not be the end of that investment or the limitation on the size of the population of people served.
Again, congratulations for this work. Thank you.
Thank you, sir.
I have a few questions. Can you talk us through, Ms. Gray, whether people were able to bring their belongings with them, and in the instances where they were not able to bring, if there were instances where they weren't able to bring all their belongings, were they able to utilize violet storage? I know we've had some questions about belongings that were left behind at the encampments, and I know that you all worked hard to make provisions for individuals and their items.
Sure. Charles, would you like to speak to that?
Absolutely. At a number of encampments, we did make violet heat-safe storage available and accessible to occupants prior to move. Additionally, occupants were enabled and empowered to bring key belongings with them. So that includes necessities of daily living, critical documents, medications, and means of transportation like bicycles. However, acknowledging that encampment occupants chose to leave some of their belongings behind, and in many circumstances it was not feasible to move the entire accumulated belongings at an individual encampment or campsite into shelter.
Thank you, though, for verifying that important documents and other kinds of personal belongings that there were provisions made for those. So could you also address the issue? There was a reference earlier on to how that one of the hotels that we've just purchased will be dedicated in part to the next phase of HEAL. Could you just clarify that, Ms. Gray?
Yes. To clarify, it's not one of the hotels we just purchased. I was referring to the Country Inn, which the city purchased about a year ago, but had been operating heretofore as a Pro Lodge. And so we knew that council wanted directed us to look at additional sort of emergency resources in the context of the passage of Prop B. And so the conversion of one of the former pro lodges into shelter was an approach that we took pretty immediately after the passage of Prop B and the assignation of resources for that purpose. Our thinking is that we could continue to utilize North Bridge partially for HEAL, but we also want to ensure that there are resources, particularly for those people who may be experiencing enforcement on the part of APD, who need to leave an encampment or face citation, but who, in particular, who are quite vulnerable, whether that be medically or to victimization of some sort. And so we have not made a final determination, but one of the conversations that staff will be having over the next month or so is, of the, say, 65 available rooms total at Northbridge, how many of those do we want to set aside for the HEAL initiative, and how many do we want to have set aside for other purposes, for situations in which, again, APD or host encounters someone who is very vulnerable and we'd like to be able to bring into shelter. I apologize. I have to live through my dog joining me for a brief moment. Or even prioritizing those folks who are otherwise at the top of the coordinated entry system list.
Great, thank you. And my last question, and then I have just a quick observation before we move on. Can you talk a little bit about some of the work that has gone on at the different sites? I know early on there were conversations about how to reactivate some of these sites, or how it would be communicated to others, either through physical changes or through other means, that these sites were no longer available for public camping. And I wondered if you could give us some examples about how you or your partners across the city have have implemented that vision.
Sure. And so I'm going to hand this to Charles to speak a little bit as an example about the Terraza site, and then potentially also about the downtown site. There are some sites, for example, the underpass, where it functions as an underpass, and we mostly need to keep it clear. But I will mute for a moment and let Charles speak to that.
Mr. Lucen, are you still with us? It seems he may not be. So I think we'll just keep that as a pending question, and hopefully we can get some more information about that. Ms. Gray, are you still available?
I am. I see Charles is off mute, but for some reason we're not hearing him.
Okay,
So,
no worries. Well, we can follow up on that. Perhaps in the follow-up information you can give us some examples about how those sites are, whether it's the host team going out and reminding people that these areas are not available for public camping, or the Parks Department putting different things in place along the trail, or what kinds of ways.
Kathy, I
Happy to
can
do so.
speak.
Apologies. It appears Charles is having some connection issues.
Kathy, I can speak to that if you want.
Sure, Councilmember Kitchen, if you want to give us a few examples.
Just quickly, I'll give you one example at the Menchaca, the overpass at Ben White and Menchaca. The short-term immediate effort has been to a combination of delineating the bike pedestrian path under there as an initial approach. Longer-term approach is looking at various aesthetics that could be employed under that area, including, whatever we can work with TxDOT on that might relate to beautifying the area, making it more welcoming. So that's an example of one area, both short-term and longer-term plans for that area.
Great, thank you. And I know these will be different depending on what area of town and what the structure is like. So it would be interesting to hear some of the examples in the other areas as well. You know, I think these numbers, first of all, I'm not sure that all of our staff are still on the call, but I also wanted to commend them for their tremendous work. This was a big effort that had to be done very quickly with very limited resources. And as my colleagues have said, I think you did just a tremendous job. You know, as I think back to the conversations, both in the time when we first started a couple years ago, thinking about an encampment strategy, to the time when it was going through council this last spring, there were concerns about how closely the population housed would mirror the overall, and the concerns that I heard were those of equity. And you know, these initial numbers, I think, are very promising. And so I look forward to seeing how those numbers compare to the unsheltered once we get that data. But I am really heartened to see that some of what was concerning about this to some members of our community seems to be really, it really is succeeding. And I know I really appreciate the members of the community who supported this. Councilmember Kitchen, I commend you on your leadership on this. I know it wasn't a unanimous vote at council, but I am really happy to see that it is a program that's going to continue into the future, and I hope will continue to gain support both in the community as well as on council, because it is clearly much needed and is having a great impact. So I think I know there's probably more that we all want to ask on that, but because we have another presentation, we need to move on, and so let's